Hi, it's Claire again. Today we're going to talk about my placements so far. I'm on my fourth placement, which was my last placement of second year, so my last placement before I go into third year, which is a little bit scary. But I want to talk to you about how I found my placement so far, what I've learned and what I want to still learn on this placement. So my placement 4 is an 8-week placement and I'm in the community. So I'm with a team in the community that responds to people in crisis and things like that. So it's really interesting because it's been my first community placement. So to be honest, going in, I had no idea about what the community would be like or anything, and I was really nervous. So I'm going to talk to you about my first few days and tell you how they went, because they were a little bit daunting and quite scary. So basically on my first day I arrived, and they're quite a close-knit team, so everyone seems quite like friendly with each other and stuff, and my mentor wasn't in on the first day, nor was my buddy. So I think this makes it quite hard because nobody kind of has responsibility for you apart from those people. So they weren't there. So I kind of walked in and didn't know anyone, didn't know who to go to, asked for my buddy, asked for my mentor. They said, oh, like they're not in today, they'll be in tomorrow, but we'll put you with someone today. But nothing much was said at the start, so I was kind of feeling quite like isolated, and you just play things over and over in your head. So for the first few days they were actually quite tough, just getting involved in the team and waiting for my mentor and buddy to come in. And I actually found the first few days just quite hard. I actually cried the first, I think it was the first 2 days, once in placement, which was very, almost, I'm going to say embarrassing, but you shouldn't be embarrassed. I know I was embarrassed at the time, but looking back, it enabled me to have conversations with people that I needed to about how I was feeling on this placement and get the help I needed to succeed in that placement. Because although I may be giving you advice to do the same, I know in my shoes I was really nervous to do it, because you don't want to go to someone on your first day or two and say that you're not happy there or things like that. So yeah, and it wasn't so much the placement as well. I think it was just everything. I was feeling quite overwhelmed. So yeah, the first few days were quite tough. But then once I got into the swing of things, I think on my third day my mentor came in, so that helped me a lot, because then I could actually have somebody that knew I was coming in, knew what level I was at, and then we could sit down and do our induction and things like that. Basically the moral from this is just to say that placements can be quite tough at the start, and not all placements. This was the first placement where I found that tough, but the first few days are always a bit uncomfortable. You're going into a team of really close-knit nurses, doctors, physios, OTs, everything, and then you're kind of this newbie on the side, and being new is never easy, I don't think, at least in my opinion. So yeah, just take it in your stride and take it day by day. So I was coming home, and the first few days were really hard not to go over it in my head 100 billion times, which I probably did anyway, but just putting that aside, I'm realising I'm home now, I need to relax, I'm in again tomorrow, but I can worry about that tomorrow. And kind of the night before your second day, let's say, so at the night of your first day, kind of prep yourself and say, it's not going to be that tough, it's going to be fine, I'm going to do this, this and this to make me feel better. I'm going to talk to her because she seemed really nice. I'm going to talk to him because he seemed really nice. Kind of set up a plan for yourself to make it easier on yourself, so you're not going in blindsided and not really knowing what to do. So yeah, that's what I'd recommend if you're finding the first few days tough. Take it day by day and plan. Give yourself a rough plan of who you're going to talk to and how you're going to keep yourself busy and things like that. So I'm going to talk to you about also what I've learned so far in this placement. So as I said, it's an 8-week placement, but I'm only 2 weeks in. And although it's only been 2 weeks, I've actually learned quite a considerable amount. Because it's in the community, you're obviously going into patients' homes every single day. And I think it's been a complete eye-opener seeing how different people live in different circumstances with different families, different diseases, everything like that. And it's just such an eye-opening experience, because in the hospital it's hard to know what people's background and housing and family situations like. You kind of treat everyone equally and everyone's the same, and you don't really know everyone's background, and well, you do a little bit, but it's hard to imagine it when you're in a hospital because they're just in the hospital bed like everyone else. But when they're in their home, you really see what they're living like. So that was really an eye-opening experience, definitely, to see how people live, how different people cope with different things they're going through and things like that. So that was a huge big thing that I noticed definitely in the first week. There was things that I was just completely taken aback by that I wouldn't normally be used to, but I think it's a really good thing to just step back and get that experience, and that's something the community definitely gives you. And I was talking to the nurses about it, and they say that keeps happening the longer you're in the community. You just are so grateful for what you have, because some people are in a lot worse situation than you, and it kind of puts things into perspective. Because if you're complaining about something but then you go to somebody's house and they're obviously clearly in a way worse situation than you, it makes you feel grateful for what you have, and you don't moan so much because you're like, well, if they're happy with their life and they're obviously in a way worse situation than me, then I should be happy with what I have. I'm so lucky. So yeah, that's something to keep in mind. I've touched on this, but I was going to say about the difference between hospital versus home. So when somebody's at home in their own house where they've lived for years and years, they are truly themselves. You can see actually what they can and can't do. So for instance, from a therapy point of view, from like a physio point of view, when they're in hospital, you get them in and out of bed and you maybe do some stairs with them. But then when they go home, their situation might be completely different. Their bed might be a lot higher than the hospital bed. It might be lower than the hospital bed. They might have steps up to their bedroom. They might have steps down to their kitchen. They might have a big hill to get into their house. Their stairs might be really narrow and windy. And there's all things like that that you can't preempt, is that the right word? What it's going to be like at home. So when you're in the community, at least you can help from a therapy point of view. You can help with their actual stairs, like steps going down to the kitchen, steps going up, things like that. You can actually do real life what they actually have to do every day with them, which I think is really good. And on the first, I think, day or two, I went out with a physiotherapist, and I never actually spent time with a physio, and now I truly understand how beneficial they are to patients and what their role is, and that was really good as well. So I'd recommend, if you're in the community or starting a community placement soon, if your team is multidisciplinary, so if you have different healthcare professionals within your team, I'd recommend going out with one of them. They don't mind, and tag along with them for a day and just see. You might not be able to do as much input as you do with nursing, let's say, if you're a student nurse, but it's good to even observe. Like, I took in so much in the first few days from going out with physios and OTs and things like that. So yeah, that's another thing you could do. So that's what I've learned so far. I've also learned to do IMs. I already knew how to do them, but I'd never actually practiced them. But one of our patients is on IM ceftazidime, an antibiotic, so I was giving them the IM injection every morning for 5 days. So that got kind of me into the routine, because I was always quite scared of IM. It's not a big deal, but it's just where you give it and things like that. It's a little bit scarier than subcut, for instance. So yeah, I'm glad I conquered that fear. Also, manual blood pressures, and I know some people are really good at them, but I was a bit nervous about that before going in, since all my placements had used automatic blood pressure machines, so you just put the cuff on and press the button. But obviously manual, you have to do the stethoscope and hear the beat and everything, so that was a bit different. But yeah, now I can do them in my sleep. So it's just the first few days that was kind of daunting, but because we do manual blood pressure on everyone we go to see normally. So yeah, and if you're scared of that, because I know I have another boy who's on my placement too, and he'd never done manual blood pressures either. So we were both kind of practicing together, and now we're completely fine with them. So just remembering that you can learn those things, and you don't need to go into your placement being a pro at everything, because that's what placement's for, is to learn. And I definitely think you learn the most in placement over lectures. I just learned so much more in placement than I do in lectures. So I've also learned how to do leg dressings, and like the blood pressures, I'd done them before kind of in uni and things like that, but not that much on my patients. Because let's say when I was on the trauma and orthopedic ward, I did dressings, but they were just post-op dressings, which is where you take down the surgical dressing and put on a post-op dressing, which is just like a flat dressing. There's not much to it. While I was in this placement, I've been doing cellulitis leg dressings and things like that, where they're more complex and you have to use the right equipment and the right so you have to use the right bandages and the aseptic technique and everything like that. So that's really important, to be able to differentiate between what you have to use, what you should be using, what like how the wound is healing and things like that, and be able to look for all things. So that's what I want to learn more about. And then my wishes for my next placement, which will be placement 5, which is really scary because it's my first placement of 3rd year. I want to be able to delegate jobs more, because I feel like I'm not taking an active role in delegation, but that's okay because that's for 3rd year. I want to take more of a management approach, so not feeling bad giving people jobs and things like that. I want to improve my assessment skills. That's another thing I've been doing this placement, going out to people's homes and doing an assessment on them, and that's something I find very difficult, actually, surprisingly, the first time I did it. Just asking them so many questions. I felt like a robot, but I want to come across you know, more free-flowing and more like a conversation, but still get the answers I need to get. So assessment skills is definitely something. And then clinical judgment, which just comes with practice and time as a student nurse and a nurse. I know that, but I'd love to improve my clinical judgment, knowing when somebody like the ambulance needs to be run versus like we can treat them at home and things like that, which is something my community team focuses a lot on, trying to prevent hospital admissions and trying to keep people at home, obviously within range. If they're acutely unwell and really need to go to hospital and they're for active treatment, then of course we're going to bring them. But if we can do something to make their time easier at home, then we're going to do that before we bring them into hospital. So I hope this video has helped you and you've enjoyed hearing about my placement so far. I'm also going to do a video at the end of my 4th placement saying how it went, what I learned, and yeah, kind of the same video but in 6 weeks time. So that should be interesting to see how far I've come. So thank you so much for watching. If you like this video, give it a like, and please comment any questions you have and I'll reply to every single one. Bye guys!